Well, welcome to H360 Health Talk. Joining me here today is Carol DeGraw and Stephanie Howland from the United Way of Northern New Jersey. We're going to be talking about caregiving today, and the United Way is doing some really great things with something called their Caregiver Coalition. But before we do that, I'd like to introduce my two guests, starting with Carol. She is the Director of Health Impact Area with the United Way Caregiver Coalition with the United Way of Northern New Jersey. She received her master's in social work from Rutgers University and is a licensed social worker with over 25 years of experience. Carol not only earned her master's degree from Rutgers, but also serves as an instructor for the university's School of Social Work in their continuing education and professional development program as an adjunct professor not only for Rutgers, but also for the William Patterson University. In 2005, she was a founding member of United Way's Caregiver Coalition, which she continues to lead today. Stephanie is a manager in the United Way Coalition, Caregivers Coalition for the United Way of Northern New Jersey. She received her master's degree in social work from NYU and is a licensed social worker. She started her social work career in direct practice, working for adolescents, people with substance abuse issues, and victims of domestic and sexual assault. Stephanie joined the United Way of Northern New Jersey to work in the Caregiver Coalition, knowing it would allow her to utilize her skills and channel her passion for community education. She's a frequent speaker on caregiving and can often be found mobilizing community members to work together towards ultimately affecting positive societal change for caregivers. Ladies, welcome to the table for the first time.
Thank you
Thanks
so
for
much.
having us.
Glad to be here.
So the Caregiver Coalition, we talk a lot about caregiving here at Healthio 360. If you think about the 360 in our name, it's not only the patient, but the caregiver, the family members, and the friends of the patient all coming together and sharing the story of the patient journey through their eyes. And certainly caregivers play a real important role in this. They're probably the unsung hero in the system. Carol, start by telling me a little bit about the Caregiver Coalition. You're one of the founding members. Tell us a little bit about the mission and vision of the coalition.
Sure, happy to do that. So actually, we started, it's going to be 14 years in January. And we started really by taking a look at what was needed in the health area in our community. And there's so many great services out there, so many great people doing the services. So we invited people from the seniors community, disabilities community, and mental health community to come on in. And we, by the way, is the wonderful volunteers that we work with at United Way. Come in and talk with us about what they're seeing and to also maybe bring some of the caregivers that they're working with. And we heard the stories and listened to some incredible stories. You know, a lawyer leaving her practice to take care of her mom with Alzheimer's, a young woman who had a daughter with autism, and she and her husband had not been able to even go to dinner once together in the last 7 years because it upset the daughter so much when they left. And story after story. So after this was done, the volunteers and I sat back and looked at each other and were like, you know, this is really not about just funding a program, which at the time United Way was known to do.
Right.
This is really creating a network of support. You know, this is way beyond just one program. And we started talking about forming a coalition. And that's how it started. We are still today and across the Lifespan Coalition. Everything that we do is at the direct request of what caregivers tell us they want or they need. The caregivers are the heart of our coalition. Caregivers are at the table. We have just really evolved from there. When United Way went into a merger with 5 United Ways, we're Somerset County, Sussex County, Warren County, Morris County, and part of Essex. The Caregivers Coalition was the first initiative to go through the counties. So we now are operating 5 in our footprint.
So almost 14 years.
Almost 14 years, yeah.
And so what are some of the, if you sit back and you have a minute to think, which I know you're very busy, so those opportunities are probably rare, but when you do have that opportunity, do you look back and say, over the last 14 years, wow, there's been really some catalyst for change in the caregiver community, whether it be technology, whether it be legislation, whether it be mergers, and when you think about change and the role of the caregiver, what are some of those impactful moments where change really started to happen?
hmm I think one of the things that has struck me is at the time, caregivers were not talked about as much as they are today. So, fortunately, caregivers who are the backbone of the long term care system of this country are finally getting recognition. But this all started really because what the service providers in the field of seniors, disabilities, and mental health were telling us is that they only had the funding to serve the identified patient. They couldn't do anything to support the caregiver. So, what we have been trying to do and trying to encourage is increase supports for the family caregivers. So, we've seen that change a bit, don't you think?
Yeah, I know in hospitals now they have specific places for caregivers rooms, resources, and they actually say the word caregiver, whereas before it was, cancer information or specific diagnosis.
Right.
They have, in bigger corporations, they've really started to acknowledge that their employees are caregiving. And so there have been an uptick, I think, in the corporations that we know, the organizations we know, in really trying to support the caregivers and not just, those people that are going through the actual illness or condition or whatever it might be.
Yeah. It is interesting that I think back when I was, a child, and if somebody in the family was diagnosed with cancer, it was never really talked about. That word cancer was never really spoken. You knew something was going on because the adults at the, whether it be Thanksgiving or a holiday, would gather in another room away from the kids. You'd hear somebody would say, well, Uncle Joe or Aunt Betty, they've got C. They would never say the word, And Stephanie, with your background in private practice, you've dealt with some pretty significant issues, substance abuse and things of that nature. Have you seen a willingness of more open dialogue now and getting these conversations about these conditions and caregiving from the back room now to the front room?
I think so. I think specifically with illnesses, with physical and things that are diagnosed, in the hospital, they're really focusing on the children. A lot of the sandwich generation, what you hear, I think they're starting to acknowledge what impact that has on younger people. So there's a little bit less, I think, of a stigma as it relates to, having an illness and the understanding that we have to address that as it's happening, that there's loss that happens from the moment someone's diagnosed and not just when they pass away. And the earlier you can start addressing that, the better perhaps the reaction will be. I think where we're still struggling in recognizing that we are focused on caregivers again across the lifespan, no matter what their diagnosis or condition is when it relates to substance abuse and mental health. I think we could do a lot more to bring that out into the open. I know some counties have been focusing with stigma-free and starting that conversation, which is great.
Right.
But there's still, it's less of a embarrassment, or somebody might feel more comfortable because it's not seen as a choice that they've made to have some kind of disease, whereas we're still working on that for substance use and mental health. So
Right. I want to address two points you mentioned. One is the sandwich generation. So we see the baby boomers getting older, right? Now, people are living longer. I mean, thank goodness we've got, companies out there developing and bringing to market innovative therapies to help people live longer. So it's kind of like the domino effect, right? I mean, and then you put these people who might be in their 40s-ish, who have, the young children on one end and the aging parents on the other end, and they're sandwiched in the middle here. What kind of stress does that put on that family unit of the husband, the wife, maybe it's a single parent family, the children, as they're trying to caregive for either young children on one end and older parents on another?
Quite a lot of
We
stress.
could talk for hours on that, I would imagine, right? I mean, do we have enough time?
Yeah. Exactly. You know, it also makes me think of the one, I'll say, disease that most caregivers carry with them is guilt. They always feel they're not doing enough and they could do more. And when you're in a sandwich generation situation, you know, when you have demands from your children, demands from maybe aging parents, and maybe aging grandparents as well, it's a really tough place to be.
Yeah.
And you know what we've recently actually, and we're just in the process of finalizing a report on a caregiver health study that we did with Atlantic Health Systems. And one of the things that we found in the study is that people are so willing to help with like functional tasks. So they'll help with, okay, we'll go to the store for you, or we'll do this, or we'll do that. But the listening piece, the listening really to the concerns, to the emotions, you know, that just isn't there. And that's what caregivers are telling us they need.
Yeah. Well, I think you hit on a hot button. It is the guilt that they're not doing enough. And Stephanie's heard me talk about this before. You know, I am the son of an Alzheimer's patient. My mother is an Alzheimer's patient. My father is still the caregiver. They still live in their home in Green Bay, Wisconsin. Now I have a sister and a brother-in-law and 4 nephews in Green Bay, just a few miles from my parents' house. Now there's myself in New Jersey, a brother in New Orleans, and another sister in Portland. So it's not just guilt that the caregiver is not doing enough, it's the other siblings who are not in Green Bay and cannot maybe go over and take them a meal or take dad out for a break or watch mom for an afternoon to give my father some rest. I mean, that kind of guilt, when you sit back and say, my one sister is bearing the burden of really being kind of the sibling caregiver, if you will, that guilt is, amongst the other siblings. I can't speak for my brother and my sister, but it's certainly, I carry that with me. So how do you address that? I mean, people are going to be watching this and they're going to say, okay, that story of Dave and his mother sounds all too familiar. And what are some of the things that you can do? I mean, if there is a United Way of, let's say, Green Bay, Wisconsin, and they have a Caregivers Coalition, how do you find organizations and reach out and kind of help supplement what my sister's doing?
I think the first stop we will often tell people is every state, every county, right? Okay.
At least every state.
At least every state. I know in New Jersey we have lots of counties and areas, so it's every county, but every state has to have an aging and disabilities resource center. And so that's a really good first call to find out what services might be specifically available in that area.
So say that one more time. They have to have
an aging and disabilities resource center, and they're called the ADRCs.
ADRCs, okay.
Yep. They're often hosted through the Office on Aging and Disability Services, or whatever they're called in that particular area. So it's a really good first call if you're not sure what to do to find out what might be available. Again, they can help based on what financial resources you might have. If you have, a little bit, none, lots, there's a lot of different services, tied to that.
Yeah. So you have a study. So the United Way partners with the Atlantic Health System. So 2 great organizations coming together. When you look at the results of the study, Did something jump off the page? Was there an aha moment here that you said, wow, okay,
Oh, yeah.
this is newsworthy?
Yes, definitely.
Many?
I don't think we were that surprised because of working in it for so long. But I'm going to try to get this exact, okay?
yes.
It's 1 in 5 caregivers. So 19.5% actually showed moderate to severe depression. And that is compared to just under 7% of the general US population.
Wow.
So that is
So tell me that
extremely-
number again. That's an alarming number. I think.
19.5%. So 1 in 5, almost 20% of the caregivers
So 1 in
showed
5,
moderate to severe depression. Yeah,
not just I'm feeling a little blue today, moderate to severe depression.
exactly, exactly. Caregivers reported more than double the rate of severe depression in the general population, and with 78% of Americans having basically no clinical indicators of depression, only 37% of caregivers had no indicators at all. So vast majority of our caregivers are depressed.
And they're hiding it.
They're hiding it, they're
Functioning
living
as they
through
need
it,
to,
you know, yeah,
Wow.
yeah.
So what can we do? So now we have some data, right? And what can we do? When we think about these numbers that are increasing, and just the sheer volume, because we know, right, that depression can lead to other comorbidities down the line. So if I'm depressed, I might be abusing substances, whether it be alcohol or drugs. I might be not functioning properly at my job, and so my employment could be at jeopardy. So there's a number of things. Depression increases your stress and anxiety level, which has an impact on your coronary artery, your heart. So this is, if we don't do something, we don't manage this, it has the makings of being something much more significant further down the line.
Yeah, absolutely. One of the things I know that we always say with the coalition is, we love to get people connected to the coalition because so often they're feeling that they're really alone in this. And then when they start meeting other people who are going through similar things, it is such a relief to them to know that they're not alone.
Yeah.
Right,
Stephanie
so-
runs a Caregivers Cafe just for that purpose, right?
Yeah, the piece around what do we do and with these numbers, and I think, again, information's important, but where do you go from there?
Right.
A big piece of it is raising, first of all, awareness and letting the idea of what a caregiver is and does be known. And so that people can identify as caregivers, because one of the most startling statistics is that over 80% of caregivers don't identify as caregivers. So how can you provide a service or support to someone who doesn't know they're caregiving or doesn't identify as such?
Why is that? I mean, okay, if we're talking about an alcoholic and, the first step is admitting you have a problem, right? If you're abusing substance, you have to raise your hand and say, yes, I'm overdoing it. But why is that with caregivers that they just don't, do they not realize they're caregivers, or is it just the way it is? I mean, there's no, not that I found anyhow. I mean, people don't, grow up and as you're going through school saying, boy, I want to be a caregiver when I'm older, and there's no real manual. I think, if you've seen one caregiver, you've seen one caregiver, right? I don't think there's not a one size fits all here.
No, but they're recognizing it as something they need to do because they are a daughter, they are a son, they are a spouse, they are a parent. And so they're not looking at this as a caregiving role.
Yeah.
They're looking at it as this is what I need to do for my
Right.
family member.
Right, or if they're not doing it 24/7, I'll often have people say, well, I'm a part-time caregiver, or I'm only a little bit of a caregiver. And it's like, how are you a part-time caregiver? It's always there emotionally, you're still supporting, your loved one, just because you're not living with them and maybe providing 24/7 nursing care, which by the way happens, doesn't mean that you're not a caregiver. A lot of times a mother for a child who might have special needs also just, I'm a mother, I'm taking care of my child, which is true, but there's added stress when you're adding in something where you have to go in for IEPs or behavioral issues. That's not, what a typically developing child might have to go through. And we know being a parent is stressful enough in itself, but it doesn't make you a caregiver. So really understanding that someone who's caregiving has a lot more going on than, there's a lot of everyday stresses, but this is added onto that. And so it's important to recognize that.
Do we ever sit back and look at what the total cost of caregivers or caregiving is to society? So if I'm a caregiver and I fall into that, 20% that's moderate or severely depressed, and I'm absent from work often, and I'm either terminated or I have to leave my job, there's added cost, there's impact for me, right? Obviously, because now I'm unemployed. There's also impact or economic impact for my employer because the cost of hiring, the cost of training, the cost of lost productivity. So how do you, take cost in its totality and put a bow around it and say, guys, this is what it is?
Well, there's a number of studies actually. The one for the workplace gives the range from 17 to 34 billion. And that is just what you said, that kind of continuum from,
And $17, right? Not 17 billion, or was it 17 billion?
Billion.
17 to 34 billion
dollars,
in annual, probably. It's a
annual.
Yeah, right.
From the point of some caregivers maybe missing some time, making some calls from work, right on through to needing to replace a good employee and the cost of recruiting, interviewing, selecting, retraining, et cetera, et cetera. So that alone is a motivation for the workplace to put in basically some programs or benefits for the caregivers to try to keep a good employee. I often tell the story, my own story. I was caregiving for my mom. I had to actually end up moving in with her for a few years. And I was told, it's that phone call the one day, it's like, your mother can never stay alone again. And it's like, oh boy. So had it not been for United Way of Northern New Jersey, who allowed me to then work at home a couple days a week, I would have had to leave my job because the cost of a home health aide would have been more than I made. So, so to be able to have maybe flexible workplaces when it's possible, and we know not everybody can have a flexible workplace. Some job sharing, even having referral sources within the workplace, or at least maybe having us up in the workplace in our website so you can come to us for referrals, because also keep in mind that the value of what the caregivers are providing to our society is, I've seen a number of studies on that and estimates, but I think we're now kind of nailed around $470 billion, which is more than our national Medicare budget. So, or Medicaid, So we could not, if these caregivers weren't supported, we could not afford this as a country to take care of the vulnerable people that need to be taken care of.